Okay, now we're going to give an enteral feeding through the NG tube. You want to perform your hand hygiene, don clean gloves, and always verify the order. See if your patient has any allergies, and Ava does not have any food allergies, and you still want to have her in high Fowler's position. So first we're going to, again, like I said, you're always going to verify placement because you don't want to inject food in the wrong place. So here we are in the stomach. You can tell by the color of the gastric contents, but of course we can verify that with litmus paper, and ultimately a chest x-ray would be the best way. And when you pull back the residual, if it's less than 250, you want to go ahead and push that back in. But if you pull back and they have more than 500 cc's, you want to not give them a feeding at that time, or just say if it's two times you check the residual like an hour apart and it's 250 or more, then you want to hold their feedings and contact the physician if that doesn't change. But you are going to, before you start the feeding, you're going to want to flush with at least 30 milliliters of saline or water. Some pumps have the flush set up, but in this case you could pull up the 30 cc's of water and flush. Okay. Then, so you may have a bag set up, and you could have your bag of feeding hanging. You're always going to want to prime your tubing from a new bag, and in some cases you have the bag with the feeding or with the formula, and then a bag of water, which would be your flush, and they each would be administered at a different rate. But you know, you could spike your bag, flush the bag, attach the tubing for the NG tube, or if they have a PEG tube, and be sure you have all of your settings correct. Mark your bags with the time, date that you hung it, and you don't want to keep those bags hanging for longer than usually 24 hours or whatever your policy is, hospital policy is, and press start. But in some cases you may give a bolus, where you would, of course, you never want to force anything in, but and you could allow it to flow gravity. Okay.
Yummy food.
And then you can follow up with some water. And always be sure to clamp off, because you do not want their stomach contents coming back at you. Okay. We're kind of rotating between a NG tube and a PEG tube. Okay. So you want to set it back. We don't want their stomach contents coming out, or you may just turn their feeding back on if it's continuous. Okay, and always go in periodically and check the residual every 4 to 6 hours or so. Always be sure to check the site if you have a PEG tube. Make sure everything's, it's not leaking, no signs of infection, and document your findings. Clean the patient up. And keep up with their intake and output. If they have any nausea or problems due to the feeding. Are you doing okay, Ava?
I think I just want some more food, that's all.
Okay. No cheeseburgers. Thank you.